What is the main problem of headache? What are the types of headaches? What are the medications for each type of headache? There have been so many questions asked about headaches, including these ones. If I'm not wrong, I'm sure everyone had headache before. But, what do you know more about headache? Headache is pain in any region of the head. Headaches may occur on one or both sides of the head, be isolated to a certain location, radiate across the head from one point. A headache may appear as a sharp pain, a throbbing sensation, or a dull ache. Headaches can develop gradually or suddenly, and may last from less than an hour to several days. According to the International Classification of Headache Disorders version, headache is divided into 3 distinct categories: primary headache, secondary headache, and cranial neuropathies. The first category is primary headaches, which includes headaches not attributed to another disorder. Primary headaches are the most common types of headaches and include tension-type headaches, migraines, and cluster headaches. The second category is secondary headaches. In this category, headache is essentially a symptom of an organic or psychiatric illness or induced by a substance or drug and its withdrawal. Secondary headaches range from an adverse reaction to a drug the patient is taking to a more serious life-threatening condition. The management of secondary headaches entails the management of the disease rather than the headache itself. For example, if a patient experiences headaches due to his uncontrolled hypertension, controlling the patient's blood pressure will potentially control the patient's headache. The third category is headache secondary to painful cranial neuropathies such as trigeminal neuralgia. Trigeminal neuralgia is a condition that causes painful sensations similar to an electric shock on one side of the face. This chronic pain condition affects the trigeminal nerve, which carries sensation from your face to your brain. If you have trigeminal neuralgia, even mild stimulation of your face such as from brushing your teeth or putting on makeup may trigger pain. In primary headaches, tension-type headaches are a common headache often causing mild to moderate pain. Some describe as feeling like a tight band around their head. They usually don't cause other symptoms like nausea and vomiting. So generally they are not considered to be dangerous. Triggers that may bring on tension-type headaches are eye strain, such as from staring at a computer screen for a long time. Problems sleeping, such as insomnia and stress related to family, work or life challenges. A tension-type headache may last for 30 minutes or months. It is generally self-limiting and treated by over-the-counter analgesics such as acetaminophen, aspirin, ibuprofen, and naproxen sodium. Did you know you can cure tension-type headache without medication? How? Home remedies, like placing a hot or cold compress where it hurts, may help you feel better. Relaxation training includes deep breathing exercises which relaxes your muscles and relieve pain. Migraines. Migraine is the second most common primary headache disorder. The World Health Organization has considered migraine as one of the top 20 disabling illnesses worldwide. It is usually moderate to severe in intensity, throbbing and pulsating. It is usually felt by one side of the head or unilateral and might be associated with nausea, vomiting and phonophobias. Migraine could be associated with or without aura. Auras are sensory perceptions that occur before the headache attack, such as hearing sounds or seeing lights. A headache attack typically lasts from few hours to up to 3 days. There are a number of migraine triggers, including hormonal changes in women. Fluctuations in estrogen, such as before or during menstrual periods, pregnancy and menopause, seem to trigger headaches in many women. Drinks, these include alcohol, especially wine, and too much caffeine, such as coffee. Stress. Stress at work or home can cause migraines. And sensory stimuli. Bright or flashing lights can induce migraines, as can loud sounds. Strong smells, such as perfume, paint thinner, secondhand smoke and others, trigger migraines in some people. Migraine is generally treated with NSAIDs and Tryptans medications. Cluster headaches, which occur in cyclical patterns or cluster periods, are one of the most painful types of headache. A cluster headache commonly awakens you in the middle of the night, characterized with intense pain in or around one eye on one side of your head, associated with autonomic symptoms such as lacrimation, sweating, and nasal congestion. A headache attack typically lasts from 15 minutes up to 3 hours. Unlike migraine and tension headache, cluster headache generally isn't associated with triggers, such as foods, hormonal changes, or stress. Possible triggers include the use of medications such as nitroglycerin, a drug used to treat heart disease. Unfortunately, there's no cure for cluster headaches. The goal of treatment is to decrease the severity of pain, shorten the headache period, and prevent the attacks. Because the pain of a cluster headache comes on suddenly and might subside within a short time, cluster headache can be difficult to evaluate and treat, as it requires fast-acting medications. Some types of acute medication can provide some pain relief quickly. Oxygen. Briefly inhaling pure oxygen through a mask provides dramatic relief for most who use it. The effects of this safe procedure can be felt within 15 minutes. Tryptans. The injectable form of sumatriptan, which is commonly used to treat migraine, is also an effective treatment for acute cluster headache. The first injection may be given while under medical observation. Some people may benefit from using sumatriptan in nasal spray form, but for most people this isn't as effective as an injection and it may take longer to work. Sumatriptan isn't recommended if you have uncontrolled high blood pressure or heart disease. In secondary headaches. It's probably a secondary headache as a symptom if the pattern changes. You're pregnant. You have cancer or HIV. It's the worst headache you ever had. It came on quickly with no warning. You get the headache after you exercise, have sex, or squeeze your body. This type of headache is caused by another medical condition. In other words, the headache is a symptom. This can include a medical condition like high blood pressure. Injury, like a concussion is a traumatic brain injury that affects your brain function. Infections, like a sinus infection, sinus infections happen when fluid builds up in the air-filled pockets in the face or known as sinuses. This fluid buildup allows germs to grow. Trigeminal neuralgia. The chronic pain condition affects the trigeminal nerve, which carries sensation from your face to your brain. If you have trigeminal neuralgia, even mild stimulation of your face, such as from brushing your teeth or putting on makeup, may trigger pain. There are medications that treat trigeminal neuralgia. Anticonvulsants. Doctors usually prescribe carbamazepine for trigeminal neuralgia, and it's been shown to be effective in treating the condition. Antispasmodic agents. Muscle-relaxing agents such as baclofen may be used alone or in combination with carbamazepine. Botox injections. Botox injections may reduce pain from trigeminal neuralgia in people who are no longer helped by medications.